I'd like to thank the TSA for inviting me to speak at this conference and send my apologies for not being able to make it in person. Across the UK, our health and care systems are facing unprecedented challenges. Everyone in the room is well versed in them and fully understands the added impact that austerity brings. Despite the different approaches we've taken in Scotland, we are not immune to these issues. Simply running harder and faster is not sustainable. And therein lies the opportunity. There is a pressing need to transform how we deliver care. Digital health and care, which includes technology-enabled care, offers huge potential. It offers the potential to deliver more care in people's homes. It offers the potential to cut down on unnecessary trips to clinical environments, whether in primary or secondary care. And it offers the potential to allow far greater flexibility in how our staff teams operate. One such opportunity is represented by the shift to digital telecare. And I welcome the publication of the TSA's white paper, which you've just heard Paul Burstow speak about. In Scotland, we recognise the issues it raised a few years ago. And we shouldn't underestimate the scale of the challenge this shift represents. In Scotland alone, more than 80% of all recipients of local authority provided or commissioned social care services use telecare, or over 127,000 people. We estimate that at least a further 40,000 are supported by housing associations. And all of these people have been identified as potentially vulnerable people who rightly use their telecare systems as an important lifeline. Managing the technological shift whilst minimising service disruption will be one of the greatest challenges ever faced by the industry. The shift to digital represents an opportunity to fundamentally rethink how we want technology to support people at home and in their communities. It represents an opportunity to challenge the status quo, to disrupt and shape the market, to integrate service delivery, to explore the convergence with telehealth, to open up the use of consumer devices and the Internet of Things, to be able to make far better use of big data. Funding from the TECH programme has developed further scalable models of technology-assisted home care to support well-being, self-management and safer living at home. One such example is through the increased use of home and mobile health monitoring. Over a 90-day period, NHS Lanarkshire carried out a test of change. The study aimed to assess the benefits and challenges of remotely monitoring patients' blood pressure using text messaging. GPs were asked to recruit patients at the point of diagnosis or initiation of medication. Patients were monitored for an average of 18 days and the results were clear and substantial. It saved an average of 4.4 face-to-face contacts per patient compared to usual care. 100% of the clinicians involved in the study agreed that the monitoring had been an aid to decision-making. In 69% of cases, it led to faster decision-making, and the study revealed white coat syndrome in 33% of cases. 99% of patients who responded reported that it was easy to use, and 94% would use it again if they needed to. If all new cases of hypertension in Scotland were diagnosed in this way, some 140,000 primary care appointments would be saved each year. In Scotland, we are in the process of developing a new digital health and care strategy. As part of our engagement to date, we've had important messages back that our approach to information governance and data protection needs to evolve and be simplified, that there's no point in investing in sophisticated core IT systems without staff access to hardware where they work, that we need digital systems, dashboards and approaches that are user-friendly and intuitive, and most importantly, that we need to break down silos, cooperate better, learn from each other, and more often make coordinated improvements across Scotland. Feedback has also been positive, making clear that we have laid good foundations for further significant steps in how we use digital in Scotland to support high-quality services that have a focus on prevention, early intervention and supported self-management. In taking these steps, it's important that we learn from the successes or otherwise with digital health and care in other nations. And that's why earlier this year I established an external expert panel with international and UK representatives from government, care services, academia, the third sector and service users, and it's chaired by Harvard's Professor David Bates. I received the panel members in Scotland at the end of September to hear their preliminary recommendations. And although there are areas where we clearly need to strengthen our efforts, such as leadership and skills, I'm also reassured by the discussions with the panel that in other areas we are on the right track in Scotland, for instance with regard to digitally empowering people to take an active role in their own care. So I encourage everyone at today's conference to take the opportunity to strengthen ties, share best practice and use technology as an enabler to deliver an improved health service that can overcome the ever-growing resource demands. Scotland's new digital health and care strategy will recognise that we must continue to embrace digital solutions, as transformation of our services will not succeed unless we start to realise that digital matters to us all. So thank you, and I hope you have an enjoyable conference.